What is the cause of dementia? There are over 100 types of dementias, but there are four major types that are the most common, and I'll just touch on those very briefly. The information I'm giving is not exhaustive. You need to ask your doctor specifically what could be the cause of the dementia that your loved one is struggling with. Some dementias are caused by something as simple as an infection. UTI can cause dementia symptoms, and that can be reversed. There could be a medication that somebody is taking that is causing them dementia. But today, the question that I'm addressing is when the dementia impacts a person completely. The dementia in itself is not a disease. It's a syndrome or symptoms. There are various types of dementias, like I mentioned. Sometimes people will say dementia or Alzheimer's. Dementia is not necessarily Alzheimer's. Alzheimer's is one of the diseases that cause dementia, but not all dementia is Alzheimer's. Alzheimer's consists of at least 60% of the dementia and can be as high as 90%. So not every dementia is Alzheimer's, but there are other types of dementia. Dementia is not equals to aging. There are people who grow very old and they never have dementia. My grandfather, my dad's dad, died at the age of 104 years. He did not have dementia. There are not people in my dad's family that we can trace that have dementia. So dementia is not equals to aging. Dementia is caused by disease. So sometimes people forget more easily with age, but forgetting easily is not necessarily dementia. So these are all things to keep in mind. Again, there are over 100 types of dementia. And so it's important to nail down what is causing the dementia that you are dealing with because it will also help you with their care. So dementia is caused by various brain diseases and injuries. The most common is of course Alzheimer's. Like I said, it's caused by plaque or tangles in the brain, but there is also vascular issues, hand injury, infections, and metabolic problems that can cause Alzheimer's disease. So there's various things that can cause this. These other common dementias, like the vascular dementia, which this can occur due to poor blood flow in the brain. It's often linked with conditions like heart attacks, diabetes. It can manifest in sudden drops. Sudden drops. So my dad has vascular dementia. He has what is caused by it's constricted vessel disease is what my dad has. And constricted vessel disease can be caused by various things, including brain injuries. We need to really be careful of brain injuries. Sometimes people hit other people on the head. And when you hit somebody on the head, you could be causing them if long-term effects. So vascular dementia is caused by lack of proper blood flow in the brain. For my dad, when vessels are constricted, blood is not flowing like it should in certain parts of the brain, and so it can cause the forgetfulness, the over time. lack of thinking properly, and things like that. There's also the Lewy body dementia. This is as a result of abnormal protein deposits in the brain. With the Lewy dementia, some hallucinations. Again, hallucinations can happen with any dementia. Hallucinations is where they are seeing like things that are not there. They might say, I can see somebody hiding at the corner. And maybe they saw a shadow and it registered in their mind as somebody that is hiding. The sleep disturbances can also be part of dementia, where they are dreaming things in their REM. The REM is where people dream, and the dreams can be very vivid. They can look very real. And that's how it is with the REM sleep disorder. Is they are dreaming dreams that seem so real that sometimes they are acting out the dreams. So anyway, that's that happens with the Lewy body dementia, but those things can also happen with the other dementias, the hallucinations and the sleep disorders. The frontal temporal dementia, it affects the frontal and temporal lobes and linked to change in personality, behaviors. So this one causes a lot of behaviors. Talk with your doctors because they can have some medication that can help control this. Always remember medications have side effects. So have discussions, consistent discussions when they're on medications. Come back and discuss what side effects, because there might be different ones that might work better. So it's a long journey, and it might be a lot of trials and errors in it. And then there's mixed dementia, which is different types of dementias and can come with different types of symptoms, sometimes combined symptoms, and we may never really be able to nail down what is the cause. So, again, aging can increase chances of dementia, but aging in itself does not cause dementia. Other causes of dementia, our lifestyle. When we are young, practice good habits like exercising and eating a good diet, because the habits that we practice when we are young, our bodies are strong and they feel good, but we forget that those things actually have long-term impact on us. And sometimes the things that end up causing dementia in the end of life are things that we did when we were in our younger days. So when we are young, practice healthy habits so that as you get older, you have less chances of dementia, heart conditions, and other diseases. Dementia can be caused by smoking, poor diet, inactivity, high blood cholesterol, heart attacks, certain medical conditions, B12 deficiency, medication side effects. And some of these, again, can be treatable, like if a medication is causing it, that means a change of medication can help. B12 deficiency, if you add to the B12, that can correct the situation. But for the progressive dementia, it cannot be reversed. So, taking care of ourselves at our younger ages is very important. I believe what is really helping my dad is that he was very, very active in all his life. And so even with the dementia he has, his body has handled it really well for quite some time, because my mom has talked about this dementia for a few years before even anyone got to realize that he had dementia. So stay active, take care of yourself. Chemicals, spraying chemicals in the gardens, in the farm, and you are inhaling all those chemicals. They are impacting your brain little by little. So practicing, wear a mask. If you are a farmer and you have to spray things, wear a mask when you are spraying things. It helps lessen the amount of chemicals that you are inhaling. But also, don't keep a mask on because it impacts your immune system. So if you're wearing a mask, wear it intentionally. And then when you're done with it, remove it because your body needs to interact with germs to develop proper immune system. So it's really being very mindful of how we take care of ourselves. And caregivers like me, really, really take care of yourself. Be aware that you are carrying a lot emotionally, mentally, physically. Get help. Don't assume that you are the only one who can do it. Get help from your family members. And if you can even pay somebody to come and take care of you or be with your loved one and go out. Get away from the environment. Let somebody else deal with it so that you can also take care of yourself. Make sure you are sleeping enough. Make sure you are eating enough. Make sure you are exercising. Take good care of yourself. I have seen many situations where the caregiver actually gets so sick and dies before their loved one with dementia. It happens all the time. So if you're a caregiver, take really good care of yourself. Well, thank you for joining me. Please share these videos. I know this is a question with many. So I'm gonna continue to do my best, and let us just continue to do the best we can for our loved one. And may God bless you and keep you, and may He make His face to shine upon you and give you peace.